anaesthetists trained in paediatrics for ages above, I think, 6 months.
And I think it comes back to the point which we rehearsed this last time we had the conversation around the fact that the UCC is a primary care function that sees, that is equipped to see the sort of patients that you would see in a general practice. There is obviously additional backup in the hospital, and actually I think we've been encouraged to see that everybody who has been on the Hammersmith campus has treated all the clinical issues that have come their way with common sense. So there are, I think out of hours, there are not very many people around who are trained in that way, but then you wouldn't expect there to be, because this is a service, I think we're running a service that doesn't provide that, and if we're very clear about that, then it is much safer for those children to be taken to the fully equipped ED at St Mary's, where we have a large number of emergency department trained paediatric doctors.
I think that's exactly the point. I think for adults it's fine. I think you've got excellent provision at the Hammersmith. But I think for children, they should not be attending where parents got help them. If they think the child is sick and they present it there and something goes wrong, you have no fallback. Therefore, I would be directing them, if you have urgent care centres at St Mary's, and there's one at the Chelsea in Westminster, I think it's a duty of care that we should be directing them there. I mean, it's part of a bigger discussion that's going on between, which I'm sure you're aware, between the Royal College of Paediatrics and the Royal College of General Practitioners. And I've had this discussion with Tim and others, and I think it is a serious point about paediatric medicine being a speciality. So I'm still nervous, very nervous, about the safety of a centre seeing children 24/7 when there is not adequate emergency backup on site.